Welcome to the Department of Surgery at VCU. I'm delighted that you have chosen to interview with us in your quest for education in surgery. My colleagues and I strongly believe that excellence in education comes from excellence in patient care. We look forward to spending the next day with you, showing you how excellence in care translates to excellence in education. We have a long tradition of training in surgery from the time of the Civil War onwards and have produced numerous generations of surgeons who have gone on to become leaders in their field. We know you too will be a leader in surgery one day, and we look forward to working with you in that quest. Thank you.
Welcome to VCU, and welcome to the General Surgery Residency Program here at VCU. We're very excited to show you this video that's going to show you the ins and outs of our program. You're going to hear from residents and faculty members about the program. You're going to hear about our educational opportunities and about how seriously we take resident education here. You're going to hear about our clinical programs and the wide array of clinical programs that are available at VCU, at the VA, and also at Winchester Medical Center. Our residents rotate through all these sites and they have a great experience. I'm excited to be the program director here at VCU, and I'm excited to train with a wide variety of diverse and intelligent individuals, and I hope that you're going to give our program a serious look. Thank you.
Hi, my name is Rajesh Ramanathan. I'm one of the chief residents here at the VCU program. Welcome to VCU. I want to tell you a couple of things about our program and why it's helped me become the surgeon that I've wanted to be. VCU really is a program that gives you a lot of opportunity to pursue your various interests. Whether your interest is primarily clinical, or whether your interest is in research, or whether it's in leadership, VCU will offer the options and the opportunities to pursue those different paths. In my 7 years here, I did 5 years of surgery as well as 2 years of research. I've had the opportunity to do basic science research, clinical outcomes research, quality improvement studies, and managed to be productive in all those endeavors. In addition, I've had the opportunity to be involved as a leader, both locally as well as in our regional ACS committee. These have been an invaluable step in helping me develop and find out exactly how I want my future to emerge.
Hi, I'm Dan Newton, one of the chief surgery residents at VCU here. I just want to talk for a minute about what my experience has been like here and how it's afforded me pretty amazing opportunities to kind of get where I wanted to be. Beginning in even the intern year and beyond, our clinical experience has been excellent, as is the surgical experience. I'm very comfortable doing most procedures really on my own now. Aside from that, though, which I'm sure you'll hear a lot about, some of the research opportunities here are very good and really limited only by your own sort of ambition. Between the biotechnology park and the sort of opportunities in the department itself, it's really only again limited by what you want to do and kind of what you can make of it. I didn't do any dedicated research time in the lab, but I've been able to present at a number of national and regional meetings, and actually a couple of international ones as well. So really, whatever you wanted to make of your experience here is what you can get out of it.
When I was an applicant, one of the things that I was really looking for was a program that had a lot of flexibility. I wasn't sure if I wanted to do research yet, and so I wanted to make sure I didn't end up at a program that forced you into the lab for years, even if it wasn't something that you were interested in doing. On the flip side, I wanted to make sure that I went to a place that if I did want to do research in the lab, they had the resources available to make that possible. And I think that VCU really has the opportunity for people, if they're interested, to do whatever they want. We've got a lot of funded basic science labs in several divisions, and it seems like we're adding more resources every year. If there's not basic science in the areas that you find to be clinically interesting, We have collaborators in other departments and other schools in the university to really facilitate finding a project that can match your interests. In addition to this basic science, all these basic science opportunities, we also have clinical projects in every division, and faculty who are very eager to mentor you through either developing a research project, submitting abstracts to national meetings, to getting publications put together and submitted and accepted, and these are opportunities that are available for you if you're interested in them.
Well, hi everybody, my name is Paula Ferrara and I am the Director of the Surgical and Trauma ICU, as well as the Director of the Surgical Critical Care Fellowship, and I'm here to tell you of the amazing opportunities that VCU Surgery has when you come here as a resident and learn about critical care. We're a particularly busy unit. We not only take care of surgery and trauma, there's transplant patients in our unit. We also see the burn patients in the 8th floor. We are very heavy in the use of ultrasound. That's why we have it here. We have about more than 4,000 ultrasounds performed by non-cardiologists for fluid resuscitation and to evaluate the hypertensive patient. We have a curriculum that is a recurring curriculum, and we have a website with the lectures specified by organ failure. The residents here have a great time. We have communication with nurse practitioners, pharmacists, nutritionists. We have residents also from anesthesia, OMFS, plastic surgery residents. So then the general surgery residents are able to have an amazing rounded education in critical care.
So the excitement of being an intern on the trauma service here at VCU comes from a couple of things. It comes from the wide variety of cases we get. We get all the stabbings and shootings that occur in Richmond. We also get transfers in from different hospitals, the very, very complicated cases. And I find these, as a trauma surgeon, I know I'm biased, but I find these to be the most exciting part of medicine. You never know what's going to come in on any given night, but having the confidence to know that you and your team can deal with whatever comes in is very gratifying. And I think that most of our students and most of our interns and residents get a great experience here at VCU. Our numbers of trauma admissions go up every year as we get busier and busier. This busyness adds to a sense of satisfaction at the end of the day, and it makes the day go very quick for me. When I do a call on a Saturday, say, the call feels like it lasts only a couple hours when it's a 24-hour call, because time goes by very quickly when you're having fun and you're excited about what you're doing. And I think that's the key here, is we have a good time doing it, but it's a very exciting program, the trauma program here at VCU.
Hi, my name is John D'Antonio. I'm one of the general surgery residents here at VCU, and I'd like to welcome you to your interview here. I'm here to talk about the trauma bay experience as a resident. Our trauma bay experience, we cover the full gambit of trauma here at VCU. Everything from penetrating trauma to MVCs and large burns. With this experience, when you graduate, you will be fully capable of taking care of any trauma scenario. Our trauma bay is broken up into 10 separate bay beds that then can be converted into a single large room for mass casualty scenarios. Also, in our trauma bay, we have 2 CT scanners that are in close proximity as well as easy access to the OR. However, the best part about being a trauma resident here at VCU is, as a trauma chief, you are in charge of the trauma bay. The attendings are in close proximity, but there are no fellows and you make the decisions. And with that, I believe that as a graduating chief from this program, you are very capable of taking care of almost any trauma experience.
And I'm lucky enough to talk to you about some of our best rotations here at VCU. And I think I'm going to start with pediatric surgery. That's the current service that I'm rotating on. I'm on the second month of 3, and it's been a great experience so far. And it's been echoed by all my other fellow residents. We have a rich history here at VCU, and there's no question as to why a lot of residents are often drawn to that rotation and end up wanting to do pediatric surgery. I'll start with some of my experience for just the past 2 weeks. The procedures that I've been involved with, and often doing the majority of the procedure with the attendings, that being a laparoscopic congenital diaphragmatic hernia, multiple laparoscopic Nissen fundoplications, both laparoscopic and open. When we're doing this on kids from NICU, 25 weeks old and older, and the experience is amazing that I've had, and it's living up to the expectations I had when I started. And this experience is not only limited to me as the chief on the service, but my junior residents get to enjoy that as well. The best experience I can remember from my second year is we have the opportunity to go to St. Mary's, a community hospital here in the community, and we call it almost Dr. Heaven, because we get to go there and we get to operate, and that's all we do there, really get the experience to work with the attending one-on-one as a second-year resident. And the experience, I think it's a highlight of our second year. And to top it off, we get free food over there, which is pretty nice. So I'm thoroughly enjoying this rotation. I expect to learn a great deal more as the months go by. And it's something I'll take away from this rotation and likely utilize in terms of my leadership skills for other rotations as well. So I can't speak more highly about it. The other rotation I'd like to talk to you about is surgical oncology. It's a large service with a great breadth of different procedures that we perform. My personal interest, I'm interested in colorectal surgery, and so as part of that, we get a lot of experience laparoscopic as well as open tumor debulking and colonic resections. And we actually get a chance to get on the robot. The program here, we're lucky enough to have a significant amount of training to get on the robot and get that experience so we can get on the console and really participate in those procedures. And I'm getting a chance to do more and more every time I'm entering those cases, which is very exciting to see as that's going to be a big part of practice in the future, and it's going to be a tool for us moving forward. In addition, working with the attendings, it's a great experience in terms of working in multidisciplinary conferences for tumor board. So we really get to see how we treat the patient before, during surgery, and after surgery. And working with just people that you really enjoy getting it done with. So I can't speak more highly for that. And those are just some of the experiences that we really get to afford here at VCU.
In my opinion, our time up at the Winchester Medical Center in Winchester, Virginia is excellent. The experience is wonderful because it gives us an opportunity to really focus on our time in the operating room and developing new technical skills. It's a great perspective on how surgery can be practiced not only in private practice setting but in a community center at a large hospital with a level 2 trauma center. We spend our time rotating with general surgeons in a private practice, with a group of surgeons that focus on emergency surgery as well as trauma surgery, as well as with a small practice of surgical oncologists. The experience is very similar to being an apprentice of a practicing surgeon, which I think allows for a very different and an awesome dynamic between an attending and a trainee.
Hello and welcome to the VCU surgery program. My name is Gretchen Aquilina and I'm one of the attendings on the bariatric and gastrointestinal surgery service. When you rotate with us, you'll have exposure to lots of laparoscopic and minimally invasive surgeries, not just bariatric surgery, but also lots of foregut, anti-reflux, and complex revisional surgeries. You also will have exposure to lots of different hernias, lots of different types of hernias, big hernias, small hernias, laparoscopic inguinal hernias, open ventral hernias, laparoscopic ventral hernias. We also do lots of complex abdominal wall reconstructions where people have loss of domain or many recurrent hernias that require a separation of components. You'll also have some exposure to robotic surgery as well as some exposure to colorectal surgery. Another aspect that I think is integral to your surgical training is your ability to evaluate patients in the outpatient setting and make a plan to optimize and reduce the patient's risk. And you will also have that opportunity on our service. We do a lot of preoperative counseling, smoking cessation, and weight reduction to help improve our patients' outcomes and improve the quality of the surgical care that we give our patients. And I think that's very important, and that's something that you will have exposure to learning on our service.
The Richmond VA Medical Center is one of the flagship hospitals for the VA system and is actually the fastest growing VA in the country, and they predict us to continue to be the fastest growing VA VA Medical Center over the next decade or more. It's a very exciting time to be at the VA. We're undergoing a lot of renovations. We currently have over 200 inpatient hospital beds and 9 operating rooms, but are undergoing renovation to add an additional 3 fully integrated operating rooms and recovery room at this current time. In addition, we're making plans for 6 new ORs to be added in our next phase, and brand new surgical intensive care units and medical intensive care units. The VA surgical services are very well supported. We have represent all 12 surgical specialties there, with the exception of trauma and liver transplant. We've just started a bariatric surgery program, a wound healing center, a cancer center, and are exploring restarting our renal transplant program. We already perform cardiac transplants and LVADs at the VA Medical Center.
Hello, I'm Patty Lang. I'm one of the pediatric surgery attendings here at VCU, and I'm also the director of surgical simulation. And I wanted to tell you a little bit about our simulation center. This is a state-of-the-art 2-story unit that's housed at the medical school. We have several different opportunities for students, residents, and faculty to train here at the simulation center. It can be as basic as doing some basic surgical skills with suturing techniques, to more advanced robotics training, as well as certification in endoscopic and laparoscopic skills. We also have rooms that simulate an outpatient clinic or an inpatient office, where we have standardized patients that can take you through a clinical scenario and teach you how to give bad news to patients or to interact with patients and families. We have several rooms in our simulation center that can simulate an intensive care unit. We have a state-of-the-art, very large operating room theater where we can simulate actual surgeries as well as team training. And we have a skills lab where you can practice advanced laparoscopy, and where we house most of our virtual reality as well as surgical simulators. During your training here, there is a curriculum where you will probably spend a day or 2 a month here at the simulation center practicing those skills. We also constantly revive and improve our skills as well as education curriculum throughout the year.
Hi, I'm Dr. Sudha Jaraman, one of the trauma faculty here at VCU Health. Every trainee wants to know when they come into surgery residency whether they'll have any opportunities to get their feet wet in global surgery. Whether you've had some experience in global surgery or none at all, we have opportunities waiting for you. We have clinical rotations in Colombia and Ecuador through my colleagues Dr. Ferrata and Dr. Rodas. We have research projects in the short term and in the long term in Ecuador and Rwanda through my own work there for the last 5 years. If you're interested in creating a career for yourself in global surgery, we have the International Trauma Systems Development Program that has participated in Latin America for over the last 15 years. So whether you have any experience or just a little bit of interest in global surgery, VCU is the place to be.
So one of the things I've loved most about my time at VCU is what I think is the amazing culture that's been created in our residency, both among the residency classes and between them, and amongst all of the residents involved. So I remember interviewing here as a 4th year, and that was one of the greatest takeaways that I had. I just loved the sense of community and relationships that I felt had been fostered here, and I think it was even more true once I finally arrived here.
Looking back, I think I'm so happy that I came to VCU, and the number one reason that I'm happy about my decision is that VCU is a place that really cares about family. I think that a lot of programs talk about, how you can have work-life balance and that you can have children while you're in residency and that you and your spouse can be comfortable. But at VCU, it was one of the first things that the program director said at my interview was that here is a place where residents, men and women, have children during residency, and it's normal. And not only do they talk about this, it's actually something that they really are behind, because they have a daycare facility that keeps surgeons' hours, which is literally unheard of.
Welcome, residents, to VCU and the Medical College of Virginia. The Department of Surgery asked under Dr. Kesselrajan's direction that I speak with you for a few minutes about a relatively new program, both with us here and in most other surgical training programs around the country. I represent the program, but am aided by other members of the faculty, Drs. Ferrata and Grover, in introducing a program really directed at you. We're calling it, for lack of better words, a residency wellness resiliency program, because that's what we're really after. We want you to be resilient in your work, and we want you to feel supported by all members of the department.
As someone who's not originally from Virginia, I can tell you that Richmond is a great place to live. There are so many different options on living locations. It could be in apartment buildings, converted hotels, old renovated tobacco factories, or historic Victorian homes. You can live in the downtown area and have the advantage of being able to walk to work, which is a fantastic advantage when you've had long nights at the hospital. The other options is that you can live in the surrounding communities of Church Hill, the Fan, the Museum District, or Shockoe Bottom. Lots of different options. And when you're in the city, Richmond has really become quite the foodie town. You'll find all over the city different farm-to-table options where the menus change as the ingredients change, and it always makes an excellent culinary experience. And Richmond has very close proximity to the Chesapeake, so we have some great seafood in our city. You're looking for any kind of cultural activities, we have theaters, we have museums, and it's just an excellent opportunity to see traveling Broadway shows, the Richmond Symphony, the Richmond Ballet, or any kind of musical concert, or even traveling up towards DC and having easy access to big outdoor concert events. Looking for some kind of outdoor activities, the surrounding communities, or even in the downtown area, we have the River City. So you have the James River, you could be kayaking, you could be stand-up paddleboarding, you could be white river rafting. Or you could do what I do, which is run along the trails, the islands, Belle Isle, Browns Island, up and down bridges, just an amazing place to live. It's a great area. You can work downtown and live downtown or live in the surrounding areas, but Richmond's a great place to be.